is because the New York Doctors Coalition is part of our coalition. And Steve is here today to speak in behalf of them and talk to us about why doctors think that workers must have a one fair wage.
Thank you. So yeah, my name's Dr. Steve Auerbach, and I'm actually here representing two groups because I'm proud to say that in addition to the New York Doctors Coalition, which is a group that stays in solidarity with a wide range of social, economic, political determinants of health, that over the weekend, the Physicians for National Health Program New York, the single payer folks for the New York Health Act also endorsed. And in fact, expedited the endorsement because once it was brought to the attention, they knew. So, but you don't have to be a doctor to understand that a higher income and a stable income is good for health. Yeah. This is in what technical terms we call duh. So one fair wage obviously means less economic precariety. It means more secure housing, nutritious food on the table, the ability to take care of your family, to take care of your children, to take care of yourself. So a living wage just means a reduced amount of stress. And stress, we know, from peer review, academic studies, helps improve healthcare. Having food improves healthcare. Having stable housing improves healthcare. Having everything else that goes with having a living wage, having a one fair wage, goes with healthcare. And as we've heard, in addition, the current subminimum wage tip-dependent economy directly incentivizes and has been proven to create higher levels of sexual and other forms of physical assault. This is physical assault. That's health also. So we've got to put an end to this kind of exploitation. A one fair wage means reduced injuries, sexual and physical assault, means decreased violent crime, because sexual assault and physical assault and harassment are crimes. And so I would say that it's not only an economic and a health justice measure, but dare I say it's a crime prevention measure? And who amongst your colleagues is going to vote against the crime prevention measure? So let's point that out to your colleagues and also to the governor. So lastly, as a physician, I would be remiss if I didn't point out that tip-dependent workers don't often have healthcare benefits as part of their employment, which, many of these are small businesses. Workers will have to pay for their own or do without. And frankly, even at full minimum wage, buying health insurance is likely to be very expensive. So I would say that we need to fix this, but also for all persons living in New York, regardless of income, regardless of sector of employment, regardless of the employer's whim or other changes in life circumstances, everyone living in New York ought to have comprehensive, guaranteed, affordable health coverage. Yeah. And that's why we also support the New York Health Act, which back with Ashore, and I think everyone just really agrees. And lastly, we point out that, of course, 7 other states, as we've heard, and additional jurisdictions, D.C., Chicago, have already got the one fair wage. And, despite the claims, last I heard, California and Minnesota had restaurants. Yeah. Who knew? They got plenty of restaurants. They're making money, and they're serving affordable food. So it's really just long past time that New York joins these other peer states that we'd like to compare ourselves to. And so I say, let's pass one fair health, one fair wage. See, it's all the same. It really is all the same. So yes, let's pass one fair wage for a healthier and more just New York.
One fair wage! One fair